Today we responded to a parent who wrote in and asked about guanfacine for ADHD. While guanfacine can be used to treat ADHD, it's often not a first-line therapy. What ends up happening is a lot of parents come in and they're not ready for stimulants. And so they'll tell the provider this, be like, hey, I don't want a stimulant, I want to do something else. So they'll order clonidine, guanfacine, Strattera, and while those are great adjunct medications or great transition medications, they're not great first-line medications where if a child's ADHD is all out of control, we don't really have the skills or the scaffolding to be able to manage their behavior, those medications aren't really going to be beneficial. Now, the reason why I don't like providers and the reason why I don't like using guanfacine as a first line therapy because it can be a great medication later on down the road. But if you use it first and it fails, oftentimes parents won't ever go back to it. They'll be like, no, he had a bad reaction to it. It failed. We don't want to waste our time on that medication. Well, it failed because you tried to use it as a monotherapy by itself for acute symptoms. Where oftentimes if you treat the ADHD symptoms with a stimulant, you develop the scaffolding, then later on down the road, you can utilize guanfacine as a great adjunct medications to manage other aspects of ADHD if needed.